Bren here, aka the Gut Whisperer, in front of the whiteboard. And in this video, I'm going to be talking about diverticulosis. It is a condition, a serious condition of the large intestine. It's also known as, or you may have heard, diverticulitis and also diverticula. I'll explain all of the definitions soon. But what causes it? Well, IBS, irritable bowel syndrome. Oftentimes, people will get a diagnosis of IBS, but the practitioner doesn't know exactly what's causing it. A lot of times, individuals will get a colonoscopy to determine what's causing this. And a colonoscopy will, in fact, come back conclusive if you do have diverticulitis. However, if you have IBS, a colonoscopy will often come back inconclusive. But IBS is definitely a considering factor when looking at this condition. Stress, there's all different types of stress. Certainly stress management is a big one. We have physical stresses, we have emotional stresses, the food that are the end of our fork, or if we smoke them, or if we inhale them, those are also stressors that can contribute to this condition. Diet and lifestyle, like I said, what is on the end of your fork? How much stress management do you have? Exercise, movement. If you're sitting on a desk 8, 9, 10 hours a day, if you're exercising or not exercising, diet and lifestyle is a huge, huge thing to consider for all diseases for that matter. Genetics, with this and most conditions, genetics plays a small factor. It's like 10%, maybe 15% if you have a genetic predisposition. But what you really need to understand is what your epigenetics are. And that means your environment, right? Diet and lifestyle. The cells of our body, are they exposed to a healthy environment that's conducive of growth, or are our cells in an environment that really is going to progress into cell death, full of toxicity and so forth? So genetics plays a small factor, but it's epigenetics that plays a big factor. Toxins, glyphosate. I want to say it again, glyphosate. That is a huge one. Glyphosate, also known as Roundup. This is it's a terrible toxin. It's a chemical that's sprayed on all different types of crops for our produce. Glyphosate, it's really, really bad. And then I'm going to tie that into GMOs, genetically modified organisms, genetically modified foods. So these are main causes that cause this condition. Now, I'm going to give you a quick little anatomy lesson 101 just so you see the colon. And then what we're going to do is we're going to zoom in and I'm going to show you what happens when someone has diverticulosis or one diverticula or multiple inflamed diverticulitis. So right here, there is the this is the large intestine, this is the gut, this is the ascending colon. Look, there's the appendix. When we're consuming food, obviously it goes in from our mouth into our esophagus, down into our stomach, where it stays for a few hours, where it's being broken down. Then it passes into the small intestine. It's very, very watery, right? The food continues to get broken down and absorbed, starting to get absorbed in the body, but it's still watery. And then once it enters into the ascending colon, that's where the water starts to get pulled out more and more. That's where the fecal matter really starts to develop as it travels across the transverse colon, continuing to get harder and harder. And then as it's going down trajectory into the descending colon, and then eventually out into the rectum for exit. Now, when someone has diverticulosis, there are little pockets, and this is called, these individual pockets right here, they're called lumen, all right? Or multiple lumina. These little lumen pockets, they're like muscles, and they're responsible for the continuation of the movement and of course the absorption of nutrients and the prevention of fecal matter entering into our systemic bloodstream. But what happens is when someone has diverticulosis, they've got these little, it's almost like a weak spot. Actually, I was reading that most cases, this is where the kind of like a blood vessel enters into these lumens, and that's where a weak spot happens. And what happens is there's a little protrusion, and fecal matter can kind of invade into this and block this. So now I'm just gonna zoom in so you can really get an idea. Okay, as you can see right here, this is a kind of a magnifying lumen right here. This is one of the portions of the large intestine. And what happens when someone has a diverticula, there's basically a weak spot in, it's like muscle tissue. And what happens is we've got fecal matter that's traveling along in this tube, and sometimes a piece of fecal matter will enter into this little opening and block this. And sometimes the first step in this condition, there's just a pocket and nothing blocks this pocket. It's just a weak spot, but it still can be fixed. The second sort of development is when fecal matter starts to go in and it blocks. And basically this is where it starts to get infected a little bit. Bacteria will start to grow and multiply because that's what bacteria does. And this is serious inflammation, and a treatment is antibiotics. Now, the third phase of this condition, you can have little tiny fragments of fecal matter that escape through these little tiny protrusions, and this will cause serious inflammation. All right, so much that even tissue around starts to get inflamed. It can be very, very painful. This leads to hospitalization, and it is definitely not something that somebody wants. The fourth level of this condition is when you've got some serious leakage happening and you've got even more fecal matter invading into the body. This calls for, like I said, an immediate visit to the hospital. And now we're going to talk how to properly treat this condition. All right, so now that you've got an idea of how this condition develops, here is a solution, here's a treatment approach that you can do. Now, you've got to understand what's causing this. What's causing these protrusions? What's causing this inflammation? Well, first and foremost, like I said, all of these stressors, all of these lifestyle things, food, and lifestyle. So we need to completely eliminate all of those things. Here, I'm going to give you an analogy. Let's say I were to cut my arm, okay? And I use this with all of my clients. Everyone gets this analogy because it just sticks. So let's say I cut my arm and I continue to aggravate it, right? And I don't let it time to heal. Will that cut heal? No, in fact, it's going to start to get seriously inflamed more and more and more. It's going to start to ulcerate because the tissue is going to start to get significantly damaged. If I continue to aggravate it, eventually there's going to be some serious DNA damage, so much that eventually a tumor will form. And that's just the natural progression of inflammation. So it's the same thing with your gut. It doesn't matter what you're eating. If you have an inflamed gut, and if you've got those micro tears, also known as hyperpermeability of the gut, leaky gut, which pretty much everyone has to various degrees. So if you've got that, it doesn't matter the food that you're eating, you're still doing this to your colon. It doesn't matter what you're eating. I need to say this, emphasize this so much. You think you're eating healthy food, it doesn't matter. You're still continuing the assault on the tissue. So what do you need to do? You need to completely eliminate everything from your diet temporarily. One of the things, I guarantee you, your doctor, your GI specialist aren't going to tell you this. The cells that line your gut are the fastest regenerating cells in your body. They're replicating and regenerating every 3 to 5 days. But if you've got an environment that's completely inflamed and you're always causing an immune response and you've always got inflammation, those cells are going to replace and regenerate themselves in an environment full of toxicity and inflammation and so forth. But what you need to do, you need to completely eliminate everything from your diet, allow those cells to regenerate, and then get tighter and healthier together in an environment free from completely everything. We're going to get rid of that assault, and the assault is food, environmental toxins, food additives, stress, and so forth. Even some supplements. We're going to get rid of completely everything. Once we know that those cells have regenerated in an environment and then they're nice and tight and they're healthy and there's less inflammation, then we can reintroduce healthy foods and some supplements to really help heal and seal the gut and significantly reduce all of this inflammation and get these cells stronger and tighter. Now, I didn't even talk about the normal allopathic treatment for this. It's antibiotics. And in these cases, antibiotics are very necessary to help reduce and get rid of that infection. But you've got to reestablish healthy gut microbiome environment with healthy bacteria, beneficial bacteria. So this is the approach. Whenever I'm working with individuals, it's always the same thing. It's the same approach. We've got to detox, we've got to empty the gut, and then establish a new foundation, and then build our foundation from there with healthy foods, foods that complement this whole process and not cause further agitation and inflammation. So if you know someone that has diverticulosis, diverticulitis is when they're all inflamed and we've got some serious infection happening. It's also known as a flare-up, and it's not pleasant. It's very painful. But there is a treatment. You have light at the end of the tunnel. And I've got plenty of experience. I love working with individuals, and I like to help heal and seal people's guts. So if you found this valuable, please hit a like, hit a subscribe, share this with someone. I think this is valuable information that some people are not getting quite the gist of. And I didn't even talk about foods. Many cases, practitioners or professionals will say, we got to have more fiber. You got to cut the red meat. And in fact, the truth of the matter is you need less fiber and you actually need more healthy protein. And I'm not going to go into that right now, but trust me when I say this, if you're not hearing this normally from anywhere else and you're hearing it from me from the first time, there's a reason for that. And I'm not the one wearing the tinfoil hat. So anyways, hit a like, hit a subscribe, share this. Thanks so much.